What did it won't let us start. Hello, I'm Dr. Sandra Cabot. Welcome to my webinars, where I share information to give you knowledge and clarity to enhance your health and well-being. I've been a medical doctor for over 50 years, and I know that knowledge is power. So let's go. Hello there, everybody. This is Dr. Sandra Cabot, and I'm joined by mindset coach Igor Pershin. Hi, Igor.
Hi, Sandra. How you doing?
Great. Very good. Yeah. So we're talking again about menopause and what happens at that time in your life when your hormones disappear. Now, I often say that hormones make the world go round. And so if your hormones disappear, that's not a good thing, because you may feel a lot of changes in your body, and if you don't understand them and you don't know what to do about them, you can kind of feel at a loss. You know, it's a confusing time in your life, particularly if you're a woman, because menopause can come on very suddenly. And so one day you're fine, you're pumping out plenty of estrogen, progesterone, but the next month you've run out of eggs. So you have a sudden loss of estrogen, progesterone, and in some women, testosterone goes down a lot as well. So this doesn't happen to men, Igor, so you're probably feeling very lucky there, right?
Although I have heard there's a male version, although I know nothing about it.
No, well, you're way too young, but yeah, it's called andropause, the male version, and that it is a more gradual decline. But we do see a lot of younger men today who have very low testosterone. So this is not a good thing. You know, I have patients in their 20s, 30s, 40s who have very low testosterone, and you would hardly say they're of andropausal age. So, you know, this is an environmental thing. I think we're exposed to so many chemicals that act as fake hormones, and they really upset the testicles.
Mm-hmm.
And also insulin resistance. You know, if you're a male who eats a lot of carbohydrate and not enough protein, you end up with insulin resistance and a fatty liver. Well, then that can cause very low testosterone as well. So there's a lot we can do about that. And often it's as simple as, you know, reducing the carbs, improving your liver, taking something that will help your liver function, because your liver has a lot to do with your hormones. You know, the liver breaks down the sex hormones. And so in a man who has andropause, right, they got too much estrogen and not enough testosterone. So what happens, they're carrying the extra weight, the fat, and the fat makes some testosterone, but the testosterone gets turned into estrogen. So they end up developing breasts, what we call man boobs. And this is to do with their liver. Yeah. So if we improve their liver, maybe give them some Livertone Plus, which is a great liver formula, and give them a diet high in protein, then their liver will improve and their estrogen levels will go down. So that's very, very important. Yeah.
Interesting.
Yeah, it is. There's a lot of men out there with low testosterone, and how do they know? Well, unless you test it in the blood, you won't know. But the symptoms could be just feeling tired, feeling moody, loss of confidence, loss of drive, loss of libido. So, it can have a profound effect on a
Totally.
man.
I've been there. I've actually, yeah, there's one point where I had zero testosterone for a while because my
Wow.
pituitary gland was damaged from some trauma I suffered.
Oh,
Um,
yeah.
then luckily it recovered and my testosterone came back. I just thought it was strange that for a while I'm like, my facial hair stopped growing. And this is before I got alopecia, so it was unusual for me not to have a 5 o'clock shadow. Yeah.
Yeah. Well, that's interesting because I know you had that terrible accident.
Mm.
You're lucky to be alive as a
Yeah.
testimony to your positive mindset, the mindset coach, I mean, what you've achieved is incredible.
Thanks.
Yeah, I find you very inspiring
Thank you.
because, you had a huge challenge, and I didn't know that your pituitary gland was damaged by that
Yeah.
fall, but obviously it put you into sudden andropause.
Yeah, I guess it did in the short term.
Yeah.
I'm hearing myself. Are you hearing two of me, or is it just me?
No, I'm just hearing one.
Okay, good. Okay, well, I'll ignore
Technology.
the echo then. Yeah, it was like I'm just amazed that I came back from that. 5% chance of surviving. Um, yeah, it just goes to show that that was my time, and yeah, I've been
Wow.
sort of spending the rest of my life ever since to try and figure that out. And there was another time actually where I lost my testosterone really went down quite significantly, but that was I think that was due to chronic stress, and for a while I was
Mm.
getting injections until I was able to recover back to
Yeah.
reasonably normal levels.
Yeah. So the actual medical professionals that were looking after you after that accident said you only had a 5% chance of surviving.
That's what they said. Yeah, that's what they told my mum when I was in that coma.
Wow. That's
Yeah,
amazing.
yeah.
Yeah.
I,
And look
I
at
I
you
lost
now.
6 pints of blood.
Yes. You went into shock, that's for sure, if you lost that much
Yeah,
blood. You had
yeah, exactly.
hypothalamic shock.
Half
Yeah, well,
half the
that's why your pituitary gland didn't work because, women who have massive hemorrhage during labour, if they don't get a really quick blood transfusion, their pituitary gland will die, and
right.
so and it doesn't come back. So we call that Sheehan syndrome, and they need lifelong replacement with all the pituitary hormones.
Hmm.
So that you've done extremely well, that your pituitary has recovered
Hmm.
after losing that amount of blood.
Yeah, very very lucky.
Yeah, better to be lucky than rich. Good to be
Definitely.
both, but
Yeah, no,
yeah,
mm,
that is lucky, and I mean, it's just a testimony to your mindset coach. I mean, you're not just doing it from an academic level; you've actually done it in your own life. You've gone from almost dead to having your own coaching um, company, really. And I mean, that is just so inspiring, Igor.
thanks. Yeah, and also like it's also I live everything I teach as well. So I'm very, I practice gratitude every day. Surrounded by such a beautiful community of friends and family, and yeah, I've really cut out a beautiful little life for me here, and that's what I want for everyone else, and that's why I love working with people to help them. F I guess, yeah, help them in a way get out of their own way, and
Yeah.
a lot of the emotional burdens from their childhood that might have served them in the past, but are no longer serving them, and really realize their full potential in terms of where they want to be and the life they want to live.
Mm. It is a mindset.
Mm.
You can achieve your dreams, but you have to have the mindset to persist and to believe in yourself, don't you?
Yeah, definitely.
Mm. Yeah. Well, going back to our hormones, so for men, to achieve their goals, they need testosterone. Um, Otherwise, they're going to struggle a lot because they won't have that drive, physical or mental. So a blood test for testosterone can be a really useful thing to have if you're a male who, is not doing as well as what you think you should be doing. It could be your hormones. Now, in women, when they get to menopause, they run out of eggs in the ovary, and without the eggs, they can't produce estradiol, which is our strong estrogen, and they can't produce progesterone. So some women will find that this really disrupts their physiology. For example, they get hot flushes, they can't sleep, they're sweating, they've got no libido, they may get urinary frequency, urinary tract infections, dryness, and they may get a really foggy brain. So when all that happens at once, it's a bit of a shock. And a lot of women struggle to get help. And in the old days, we only had the synthetic hormones, and basically what we used to prescribe, back in the 1980s was horse's estrogen. Excuse me, you probably know that, do you?
Yeah, I heard about that.
Well, that's what was prescribed. It was horse's estrogen called Premarin. And, so it wasn't ideal. I mean, horse's estrogen is meant for horses, not for humans.
No.
And it involved quite a lot of cruelty to the horses too, because they kept the mares pregnant all the time and collecting their urine. So that's rarely used these days, although you can still get it on prescription. And now we have the bioidentical hormones, which are exactly the same as human hormones. So there's 3 different types of estrogen that is produced in a woman. There's the estradiol, which is the strong estrogen, and that's the one that's produced in the ovary. Then there's the estriol, which is only produced in the placenta during pregnancy. And that's a much weaker estrogen. It's water soluble, so the liver doesn't have to break it down. And then there's estrone, and that is an estrogen produced in our fat. So that's why, men who are overweight, they can end up with the man boobs. But women who are overweight as well, they can still produce too much of this estrone, and that could increase their risk of breast cancer. So once again, we don't want excessive amounts of any of those hormones. We just want a physiological amount or a normal amount. So when a woman's going through menopause, it's really important that she has a healthy liver, because the liver will break down excessive estrone, which is being made in our fat, and that's going to reduce our risk of breast cancer. Yeah. So if you are going to use hormone replacement therapy, my recommendation is that you use the bioidentical hormones, and the most popular one is Biest. So Biest has got 2 types of estrogen. It's got estriol, which is the placental hormone, and estradiol, which is the ovarian hormone. So we put those 2 estrogens together, and that's why it's called Biest, because bi means 2. And often you only need a really small dose, like 1 to 2 milligrams a day. And you just rub it into the inner upper thigh or the opening of the vagina, and it gets very well absorbed through those tissues into the circulation. So I think that, is very practical. A lot of women find that it makes a big difference, and it reduces the symptoms, particularly of the dryness and the hot flushes. We can also add some natural progesterone to that, either in a separate cream or combined with the estrogen. And if needed, we can add some testosterone. So testosterone is very important for women because it helps muscle mass. So, one of the things when you go through menopause is you will often lose muscle mass, particularly if you don't exercise. So you've got to keep that physical activity up to keep your muscles strong. And there's also a very good product called muscle food powder. Have you heard of that, Igor?
I sure have. I had some this morning.
Ah, well, you're looking good.
Thanks.
Yeah, muscle food powder. It's got glutamine, branched chain amino acids, and HMB. So it's got everything that you need to build muscle and to reduce muscle breakdown. And it's even useful for people who've had injuries and they're in a resting phase because it will, reduce muscle atrophy from injuries. So that's muscle food powder. And of course, if you need more information, you can always email us at liverdoctor.com. We love to get your emails. So, a lot of women will complain of weight gain during and after menopause, and they think, oh, it's just menopause. No, it's because the loss of hormones are affecting your muscle mass. So you've got to keep that muscle mass up through exercise and, making sure you eat enough protein. That's very important. So many women do not eat enough protein. Do you know what the protein requirement is, Igor?
It is
Testing you today.
1 gram
Giving
for every kilo of body weight.
Yeah, exactly. 1 gram per kilogram of your body weight. So if you weigh 50 kilograms, you need 50 grams of protein. So one egg has only got 6 grams. So there's so many people who don't get enough amino acids because they don't eat enough first class protein. Yeah. Okay. So the other thing is, are you absorbing the protein? So, you might improve your diet. You start eating more fish, more eggs, more meat, more poultry. And if you're a vegan, you got to combine the nuts with the seeds with the legumes at one meal. So there you are, you're eating more protein, but you're not seeing the result. It could be that you're not digesting the protein. So to digest protein, you need plenty of stomach acid. And some people really struggle with that, particularly as they get older or if they've got stomach inflammation. So one trick is you can take some apple cider vinegar at the beginning of your meal, just a couple of tablespoons, and that'll help the acidity to be high in your stomach and help you to absorb protein. Or other people take betaine hydrochloride supplement, and that can help as well. So improve your diet, get more protein, and help your absorption of protein. That's the keys. Yeah.
It's
And
so important as people get older because most of the injuries people have are when people get older are falls, and if they were training, if they were keeping their muscles strong, then they wouldn't have as many falls. So
yeah.
it's really important. The older you get, I think.
Oh, yeah. Physical activity is so important, and it affects every part of your body in a beneficial way. And see, a lot of women not only lose muscle mass after menopause, they lose bone density, and we call that osteopenia when it's only mild, but when it gets worse, it's osteoporosis. So that can really impact your quality of life because if you do fall over, you're likely to sustain a fracture. So how do you maintain your bone mass? Well, the first thing is exercise. The second thing is don't be mineral deficient. So you need calcium, magnesium, zinc, silica, boron, manganese. You need a wide spectrum of minerals to keep your bones strong. And our soils are very mineral deficient. Our foods are very processed. And when we heat food in a microwave, we destroy a lot of the nutrients. So I'm a big believer in taking mineral supplements. And I do that for my muscles and also my bones. And I've had many patients with osteoporosis who are very worried that they're going to break bones. And so they're trying to make a decision. Will I take a drug that I have to keep taking for the rest of my life? Or will I really try a program for 12 months, maybe 24 months, to see how much I can increase my bone density, because we can measure this. So I give them a good calcium supplement. I don't give them carbonate. Calcium carbonate is like chalk. You really won't absorb it. I give them the calcium that's got hydroxyapatite in it and calcium citrate. I give them extra magnesium. The calcium complete's a good supplement because it's got manganese, boron, silica, zinc, as well as the good types of calcium. So you take one or two of those every day. You don't need a huge dose, but you just need enough that you won't be mineral deficient. You need the extra magnesium. That's really going to help to build your bone density. And you need to check your blood level of vitamin D. So I do a lot of seminars, and I always ask the audience, hands up those who know what their blood level of vitamin D is. It's usually about 3% of the audience. They say, oh, my doctor told me it was in the normal range. And I say, well, what's the normal range? And they don't know. But it's a ridiculously wide normal range. Some laboratories will say the lower limit of normal is 60. Some will say 70. And then the upper limit of the normal range, some laboratories will say 170. Some will say 300. Whoa. So I don't think some of these experts have really made up their mind. But we know that if it's 100 or more, you'll be okay. So people don't know. They get told, oh, you know, your vitamin D level's in the normal range. But is it at the bottom of the normal range? That's not normal. That's not optimal.
And normal yeah. Just means that you're in the majority. It doesn't necessarily mean that you're healthy.
That's right. It's not optimal. Like the normal range is a curve, the bell-shaped curve. So if you're right in the middle, well, that's okay. But if you're still in the normal range, but you're down here at the bottom and you're told it's in the normal range, it's misleading. So somebody who's losing bone density doesn't want to be just in the normal range. They want to be optimal. So definitely want to take vitamin D, unless you're getting a lot of sun. And of course, in the winter, that is difficult. And so I recommend everybody has a blood test for their vitamin D level every year.
Unless you're in the tropics, then you're all right. Still have to get outside.
Probably, yeah. That's right. But if you're wearing sunblock, you won't make vitamin D.
True.
And if you've got osteoporosis, I would have or even osteopenia, I would have a blood test for your vitamin D anyway. Yeah. Now, the other thing that people often complain about after menopause is sleep. So particularly in the hot weather, you know, you wake up, you're overheated, you're hot and you're sweaty. That is due to the lack of estrogen and progesterone. It could also be due to the fact that your liver's not very happy, because if you're suffering with a fatty liver or, you know, an overburdened, overworked liver, your liver's working too hard, then it generates too much heat. So a common symptom of an overworked, unhappy liver is overheating, sweating, and irritability. So sometimes all you need to improve sleeplessness associated with overheating is just to do some things for your liver, like take the liver tone plus, do some raw juicing, eat more salads, quit the sugar, reduce the alcohol, and you'll sleep much better. Yeah, and then some people find that magnesium is brilliant for sleep. It helps to keep you in a deep sleep for longer. And other people find that melatonin is good, the sleep hormone melatonin, and that will put you to sleep. Yeah.
I was going to say, I've been trying magnesium glycinate lately, and that it just helps me like relax more, just unwind more, just calms the nervous system. Doesn't necessarily get me to sleep. I think the melatonin probably gets me to sleep better, but the magnesium glycinate is more for just like having a deeper sleep. That's how it helps.
Magnesium is a miracle mineral. It really is. So many people are deficient in magnesium, and a blood test isn't really going to show you. Like a blood test will show you how much magnesium is in the plasma. That's not your total body magnesium, because most of it is inside your cells, inside your nervous system, and inside your bones. So people can be told, oh, your blood magnesium's normal, but it's not. You've still got the symptoms of magnesium deficiency, which is sleeplessness, anxiety, muscle spasms and twitches, cramps, muscle soreness, migraines. So if you're a migraine sufferer, that we call a migraineur. It's a French word, but a person who suffers regular migraines is a migraineur. And they can get so much benefit from taking a really good magnesium supplement every day. So it acts like a preventative. So that's something to be aware of. So magnesium is a great thing to help you get through the anxiety of menopause, because it is a big change in your body. And for a lot of women, they feel like they've lost something, they've lost their sex hormones, they've lost their sleep, they're getting older, they are losing bone density, they're losing muscle mass. So it's a time where women can feel a real sense of loss. So you have to turn that around, into the mindset and say, no, this is a time where I'm going to gain muscle mass, I'm going to gain bone density, I'm going to gain wisdom, I'm going to improve my health. So I think that's really important, is your outlook. Yeah. So we've got a couple of questions there. Somebody from Melt. Hi, Melt. Will your body get rid of excess vitamin D? Yes, it will. But vitamin D is a fat-soluble vitamin, so it gets stored in your fatty tissues and in your bones. But you don't need to take excess. I have really never seen anyone suffer with excess vitamin D. But let's say you were to take 10,000 units every day, and you were getting sun exposure, well, you could potentially end up with a blood level that was, 400 or something, and that would be excessive. So you would have to stop taking the vitamin D, and then it would come down to normal because your body would use it up. But, if for some reason you wanted to overdose on vitamin D, that could cause some kidney stones. But it's interesting because the most common cause of kidney stones is low vitamin D. So, people who have a chronic deficiency of vitamin D, they're the ones who get the kidney stones. But yeah, you don't want to overdose on any of these things. But it's generally far more dangerous to be low in vitamin D than it is to take too much. And here's another question from Ginger. She takes 2,500 units a day. with vitamin K, and she takes magnesium, but she gets side effects. Well, I don't really know what you mean by that, because, I mean, if you take the wrong type of magnesium, you might get loose bowel actions. So I would possibly change to a different formula. Magnesium oxide can cause some diarrhea. There you go. So what about herbal treatments for menopause? You know, if you're finding that you're using the bioidentical hormones and they're not really suiting you, or you don't want to take any prescription hormones, what can you take? Well, there's different herbal formulas you can try. I've formulated one called Femphase, Femmephase, and it's very good. It's got different herbal estrogens, what we call phytoestrogens. It's got some flaxseed. It's got some minerals in it, so it's a good multivitamin mineral, as well as a natural estrogen replacement. And you just take 1 or 2 capsules of the Femphase a day. You can also have hops tea. Hops is a high estrogen herb. You can drink sage tea. That's high in estrogen. You can drink licorice tea. So these have the natural plant estrogens as well. Yeah. Okay, so I think we've probably covered the symptoms of menopause there. What tests should you have, you know, when you get to menopause? Well, I think you definitely should have a mammogram, because that's going to show up if there's any little abnormal calcifications in the breast. You could have a breast ultrasound as well. You could have a bone density test to see if you're starting to get osteopenia. You could have a blood test to check your hormone levels, and particularly your thyroid. I know that thyroid conditions are a big problem for a lot of women. I know with your partner, Igor, she had a serious thyroid problem, didn't she? That wasn't being treated correctly.
Yeah, she's doing a lot better now, but yeah, still dealing with some of the effects.
Yes, because, you know, thyroid problems are the most common autoimmune disease in the world. And so what we find is when women go through menopause and they lose their progesterone, often their thyroid problems get worse. So we know that, you know, giving a natural progesterone and even a herbal estrogen, like the Femphase, can really help the thyroid. So if you are experiencing a thyroid problem, that's going to make menopause more difficult because you'll tend to put on weight more easily. So it's very important not to be iodine deficient when you're going through menopause. So you can have a urine test, and that will measure the concentration of iodine in your urine. So you want that to be over 100, just as we said with your vitamin D, you want that to be over 100 in a blood test. We want your urinary iodine, it's hard to say, urinary iodine to be over 100 in concentration in your urine. So, you know, iodine is such an important mineral for your thyroid, because you make your thyroid hormone out of iodine, but it's also a very important mineral for your breast health. So iodine has a protective effect against breast cancer and also against thyroid cancer and also against prostate cancer. So we better include the guys there, and also against ovarian cancer. So iodine is a protective mineral. And we know that, you know, as we get older, our risk of cancer goes up more. So making sure that you have adequate amounts of a cancer protective mineral such as iodine is critically important, I think. Now we have another comment here from Ginger and Garlic. Magnesium can give me headaches, palpitations, fatigue. She's tried every type. Oh, I've never heard that before, so there you go. It usually does the opposite. That's the first time I've ever heard of magnesium causing headaches. That is really strange. But yeah, I would definitely, well, perhaps you don't need magnesium. You might have enough in your body already. So give it a break and see how you go. Yeah. So looking at other protective minerals for you as you go through menopause, if you do find that you've got more inflammation, then selenium is a protective mineral. It's definitely a good anti-inflammatory. And another mineral that is really good to know about is strontium. So strontium is a very popular supplement in America for women who have low bone density. And I saw something interesting on the TV the other day about they were analysing the crushed up bones of gladiators. They actually found, an archaeological dig site, and they had all these gladiators, and they were analysing their bones, and they found they were particularly high in the mineral strontium. And then they found out that the gladiators were given strontium supplements to make them stronger to withstand injuries and repair bone injuries. I thought, wow, that's so long ago. So that's interesting. But the strontium is a mineral supplement that I often give to people who have osteoporosis, and particularly if they're already on calcium and they're doing exercise and, if they're not getting as much benefit as what we'd like to see, I'll add in a strontium supplement. So these minerals are all very important because they're protective and they help to preserve our tissues. So I'm a great protagonist of that. And feel free to email us at liverdoctor.com. We love to hear your stories. Recently I had a couple of really interesting case histories that I'd like to share with you, Igor. I've got some patients in Temora. Do you know where Temora is?
No idea. Is that in Australia?
Yeah, Temora, nobody knows where it is, but actually quite a big town. It's north of Wagga, and kind of north west of Canberra. It's not far from Canberra. So it's a country town in New South Wales. But I had two patients in particular there who stood out, and they were postmenopausal women. So they're in their 60s, they've gone through menopause like 15, 20 years ago. But since menopause, they had put on a lot of weight. And so they were both very insulin resistant. And they didn't realize that. And they both had a lot of gut problems as well, indigestion. So they were very insulin resistant, and they both had fatty liver, which is caused by insulin resistance. So what I did is I gave them a few things to help their liver, but I put them on a low-carb eating plan. I took them off grains. Said, okay, we're just going to get you to eat protein and vegetables, and we're going to take you off wheat, rye, barley, oats, rice, and corn. So they're all the grains, and no processed food. So, they both were doing the same thing, and they were both taking like a glutamine and an ultimate gut health powder for their gut, and taking something for their liver. And over 6 months, one of these ladies has lost 16 kilograms. It's a lot of weight.
It's a lot.
and the other lady has lost 14 kilograms. So these are women who have really struggled with their weight since menopause. So, you can get really good results at any age. You might think, oh, I went through menopause 10 years ago, 20 years ago. But the long-lasting effects of the menopause and the change in metabolism that happened to your body at that time, they're still there. So, we have to go deep and find the underlying cause and address that. And then we get really good results. So they're inspiring.
Yeah, just a quick question. Obviously, as men age, our libido suffers, and luckily we've got things like Viagra for that.
Yeah.
But then with women, from what you said, their libido suffers through menopause. Can that be restored through all the interventions that you mentioned in this episode?
Yes, definitely. If I have a perimenopausal patient, so it's a woman in her late 40s or 50s or even early 60s who, has a really bad sex drive and, is worried by that, you always check the hormones. So you check the estrogen level. That's probably going to be low if they've gone through menopause, but be aware that it can go up and down a bit in perimenopause, and so can the progesterone. But what will tell you if you are truly menopausal is a test called FSH, for follicle stimulating hormone, FSH. And that will tell you that you are menopausal if it's elevated, if it's above 30. So okay, your hormones are not going to recover because your follicle stimulating hormone is high. So then we would give you some natural bioidentical estrogen and progesterone, and we would test your testosterone level. We test your total testosterone, so that's the total amount of testosterone in your blood, and then we test the free testosterone, so that's the amount of testosterone that's floating around your bloodstream freely. It's not bound to a protein carrier. So both of those values are important. And if they're both low, we know that you're going to need some testosterone. So some women will only need the testosterone if they haven't gone through menopause, because their FSH is still low. We know, okay, they're still making estrogen and progesterone. But other women will need the estrogen, progesterone, and testosterone. And it can make a huge difference, huge. And it works fairly quickly. It will restore the libido within 1 or 2 weeks. And you can rub the cream on the opening of the vagina and rub it in really well, and then the hormones will get absorbed there, and that'll make the tissues healthier there as well. Because a lot of perimenopausal women have got dryness and fragility and all that. So you need a prescription for these hormones, but that, there's more and more doctors doing it. And as I said, you can always email us at liverdoctor.com. And also the FemPhase, my natural formula for menopause, does help with libido as well. So yeah, I know sometimes women are a little bit shy asking their doctor about it, but don't be. I do have a book called How to Increase Your Sex Drive Naturally. It's just a little book, but it's on our website, and that explains it all to you as well. Yeah. But yeah, thankfully there are miraculous solutions to these problems in this day and age.
Yeah, definitely.
Yes.
Do you want me to
Okay.
put a few of my slides?
Yeah,
Got kind
let's
of
have a few of
like
yours. Yeah.
part two from the stuff that I went through last week. So I'll just bring that up. Yeah, part two, mindset and menopause. So yeah, last week, for those who didn't see, or even for those who did, really focused on around reframing. So just seeing the symptoms of menopause as signals, not setbacks.
Yes.
Bring calm, like just using techniques like breath, um, and gestures to like really ground yourself in a state
Yes.
of calm. That can really help with yeah, with any anxiety that may come up. And then visualizing your confident, calm future self rather than thinking, oh, I'm broken, or this is what my future is going to be like. It's going to be terrible. Actually, visualizing a different future, a more positive future, and yeah, and then changing your emotional state. So you can't always control menopause symptoms, but you can control your mindset. So that's,
Yeah.
yeah. For those of you who missed last week, I'd highly recommend going back and checking that out. And I just wanted to build on that. So
Yeah.
yeah, one of the processes I go through with all my clients is parts integration. That's when one part of you might be feeling loss, you might be feeling sad, angry. Another part of you might be craving that freedom, energy, wisdom, and it's actually the focus of this process is to um, find the overarching uh, common purpose for these different parts of us, and reintegrating them and realizing that they all want the same thing for us, and
Mm.
they ultimately um, yeah, and once we go through that process, you feel much more whole and feel much more congruent in who you are. So it's a really powerful process.
Yeah.
Taming the inner critic. Yeah, often when women go through such a massive change, that inner critic can really get louder, especially with the hormonal shifts, can increase that self doubt.
Yes.
For example, I'm falling apart. Um, I'm not attractive, as some of these changes manifest in our physical selves. So it's important to sort of pause and ask yourself, would I say this to someone I love? Would you say that to your best friend? All these things, and really practice that self love. So become aware of that, of your own inner critic, and yeah, and try and find evidence to the contrary, because there always is. um, I can't remember what the stat was, but something like, we have so much negative. Like, of all the self talk we have, most of it's negative. So it's important to really turn that around, and that's not just for menopausal women. That's just for everyone. Um, and look for evidence to the contrary, and challenge that inner critic, because they're always got a bit of a negative bias, but more often than not, they're wrong.
Yes. True.
Yeah.
Yes.
So yeah, this is something that we talked about last week. It's as women have as yeah as women have kids in their 30s. Um,
Yeah.
Often women will be going through menopause while their kids are still at home. So, sure, some women who have their kids earlier, they can transition into that second mountain of becoming the wise elder, um, and maybe focus on a different aspect of their life with a lot more freedom that comes with being an empty nester. But for many women going through menopause, that's not a reality. So it's important to acknowledge that, and
It
sorry.
is. Yeah.
Yeah, I've
And
got a small screen, so I'm just having trouble reading today because I'm
yeah.
running from the office. But yeah, so it's important to acknowledge that, and that, yeah, and also while you still you also got your work demands and relationship dynamics, that it can be a bit of a perfect storm. So and it's important to recognize that you're not just moody. You're doing a lot. It's important to recognize all the different roles that you're playing in your life, and definitely don't underplay it in any way, and I guess be a bit kinder and more understanding. Um, so yeah, this is where the mindset tools can really help you stay in control, even when life feels, I guess, relentless and overwhelming.
Mm. It is
Yeah.
an overwhelming time for a lot of women because of this perfect storm that you've
Mm,
described. Yeah.
mm.
Mm.
Yeah, so it's important to really really find that time to practice self-love. And yeah, this sort of segues pretty well into the this slide, which is the power of micro moments. So
Yeah.
yeah, for women who are still have all those responsibilities on top of menopause, it's probably more important than for them than ever to actually develop these tiny habits of that boosts your mood, and that can be really powerful. So even just 5 minutes here and there, step into some sunlight, like just go for a walk in your garden, um, listen to your favorite song, laugh at a reel. Just find those little micro moments that can really boost your mood
Yeah.
and like honor your
Right.
boundaries. Yeah, so these small consistent wins, they build emotional resilience over time. So it's important not to discount them,
Yes.
and they can really build up over time and really help with through this difficult transition.
Exactly. Grab the opportunity.
Mm.
Seize the
Uh,
moment.
yeah. So yeah, it's important to rewire your nervous system. So when your body, sorry, tolerated what your body tolerated before may not serve you now. So you might find that you have lower tolerance for pressure, for noise, for overstimulation. So yeah, that's why. So like the previous slide, it's important to take those few moments to step out and really
Mm.
honor that time to yourself. And symptoms may often flare up when boundaries are crossed. So this goes back to self love. So it's important to know how you want to be treated and uphold those boundaries with your friends, with your significant other, with your kids, with your work colleagues, um, and that really ties into self love. Like they're one and the same. So you you really want to make sure that you know how you want to be treated and be strict and let others know when they've crossed those boundaries. And if they
Yes.
do it again, it might be time to distance yourself from those people.
Yeah.
Yeah.
Absolutely. Yeah.
So
Self-worth. Mm.
100%, really important, especially during this massive shift. So menopause invites you to choose rest, rhythm, and honesty. So it's important to listen to your body. It's no longer an optional; it's vital. So really
Mm.
tune in
It
and really
is. Yeah.
be yourself.
It is.
Mm,
Because, it's the decisions you make around menopause are going to impact the next 30 years of your life.
mm,
Are you going to maintain your bone density? Are you going to maintain your muscle mass? Are you going to maintain your brain mass? Because uh, Alzheimer's dementia is becoming an epidemic. And I
mm,
think it is because, people are just not taking the time to think about what they're eating. They're not taking the time to exercise. They're not setting the boundaries for themselves. But this is a critical time where you create a foundation for getting older and really having a healthy, enjoyable old age.
mm.
Mm.
And if people if some people in your life are sapping your energy or taking up your time without giving much back, then you really have to be strict with your time and strict with your energy, and really surround yourself with the people that lead to that yeah, that bring out the best in you and make you feel happy, um and yeah, that time is more important than ever.
Yes.
Actually, I went to a presentation. I don't know if you've heard of Alan Parker.
Yeah, I have. Yeah.
Yeah, he was talking about how green tea can really help with reduce the free radicals that could often lead to dementia. And he recommended brewing yourself a cup of green tea at night and then drinking it first thing in the morning, and then drinking it also, I think it was before or after a walk, can really help clear out those free
Yeah.
radicals in the
Well,
brain.
it does. I mean, it's got catechins in it, which are powerful antioxidants, and people don't get enough antioxidants. You know, one of the most important thing you can do is to eat the rainbow. So, you
Mhm.
know, all the different colors in fruits and vegetables, they're polyphenols. And, well, green tea is an example, you know, it's green. It's a polyphenol. So all these polyphenols protect our brain. And I notice, you know, people just, they might have one or two vegetables, but we need to eat the rainbow. That's why I think juicing is good, you know, once a week or twice a week, make yourself a juice which has got all the rainbows, the
Mhm.
colour. And, you know, you're basically protecting your brain against oxidation, which is the cause of dementia.
Mm. And the berries can help as well with that. If you want to include some berries in that juice, right?
Yeah, berries are good.
Mm.
Well, you probably better to eat the berries. I
Oh,
would
okay.
say if you're going to juice, you know, like ginger, spinach, carrot, beetroot, maybe some parsley, some lime, maybe a bit of orange. Um, so fruits more for eating,
Mhm.
vegetables more for juicing. Because if you juice fruit, you're concentrating the fructose, the carbohydrate.
Yeah.
Yeah. But yeah,
Mhm.
I had a patient once in her 80s who thought she was getting Alzheimer's, and
Mm.
she had a diet that was devoid of fruits and vegetables, like a lot of older people. You know, they just eat a tiny amount of vegetables and they zap it in the microwave and totally destroy the nutrients. So she
Mm.
had no folic acid in her body. She wasn't getting any polyphenol. She wasn't getting any colours, in other words. She wasn't getting
Mhm.
folic acid. I said, start juicing. And within 3 months, her memory was totally normal. You know,
Wow, amazing.
it's so important to think, well, how am I going to protect my tissues? I know we've all got to get older, but I
Mm.
don't want to get degenerative disease. I don't want them to break down and become unhealthy. I want to preserve them, keep them strong and healthy. So
Mm.
menopause is a time where you develop plans to do that, for your bones, your heart, your brain. And it's all to do with diet and exercise and taking some supplements, some strategic
Mm.
supplements. And it works. You know, the evidence is there. It's definitely there. Like I was reading something from Dr. Dale Bredesen, who's a neurologist in America, and he talks a lot about reversing Alzheimer's disease. Dr. Bredesen, he's saying that, you know, the modern day treatment of just attacking the plaque is so crazy. It's not
Mm.
logical because the plaque is not the cause of the dementia. It's a sign that it's already happened. So,
Mm.
you know, just attacking the brain with drugs, it can cause collateral damage. Whereas if we know, well, this inflammatory process in our body starts in our 40s, in our 50s, in our 60s, in that time we can reverse it. So preventative medicine is so wonderful.
Mhm.
And it's just making people aware that you're more powerful than you think. You know,
Mm.
you have the power with the knowledge to actually slow down aging and be younger for longer and actually prevent some of these things that we've been brainwashed into believing are inevitable as once we go through menopause.
Mhm.
Hmm.
Oh, yeah, exactly. I'll just finish off my last couple of slides. So, yeah,
Yeah,
it's important as you I talked a bit about this last week, that it is definitely a shift in your identity. Um, and yeah, it's important to redefine who you are becoming. And yeah, you're not disappearing, you're expanding actually. So you may still be actively parenting, um, even mothering toddlers, because yeah, like we said, sort of women are having kids older,
yeah,
and it doesn't ask you to abandon who you are. It actually invites you to reclaim the space within yourself, within your existing life. So this is not about becoming someone new. It's about becoming more of who you are. So yeah,
yeah,
really sort of find out what what excites you, what makes you sing, what are the roles in your life that are most important to you, and expand them and get them to take up even more of your time and really go deep into them. Yeah.
Yeah, I
Yeah, that's
agree.
pretty much it for me.
Mm.
So yeah, there's myweekly-coaching.com if anyone wants to get in touch. And yeah, I'll just stop the presentation there.
Good. Okay, there you go. So we've covered menopause and postmenopause and preventative medicine, and Igor has given us some great tips there to keep our mindset positive and to just keep getting stronger and stronger as we get older, to keep getting more energy, to keep getting more wisdom, to get healthier and to take control of our health, to be more empowered. So if you have any questions, get in touch with Igor, or you can get in touch with me through liverdoctor.com. And we look forward to our next live stream, Igor, which will be coming up in 2 weeks.
I think we talked about doing one on sleep, because we haven't done that.
Sleep.
It was a really
Yeah,
important topic.
that's an interesting one. Yeah, we could definitely do one on sleep.
Mhm.
So many people struggle with that. We can look at every possible solution.
Yeah, I look forward to that, because I actually had a bad sleep last night. So
Oh, did you? Oh,
yeah, it
that's
might
no
just
good.
be getting used to my new house, perhaps.
Oh, a new house. Yeah.
Yeah.
Okay.
Okay.
All right.
Cool. All right. Thanks, Sandra. Thanks, everyone. I hope you all have
Yes.
a good couple of weeks.
Yeah. Okay. See you in 2 weeks. Bye.
Bye.
Well, thanks for being part of our webinar. If you have any questions or new topic suggestions, email us at support@liverdoctor.com. And don't miss our next webinar. Be sure to follow us on social media and subscribe to our newsletter at liverdoctor.com. Bye for now.